Wonderful, hot off the press, the ABC News press, 3 hours ago. Just reading this whilst having my morning coffee. Thank you to Functional Physio for sending me this. And I read it in disgust. It's a follow-up news article or editorial from a post I did the other day about the natural history or clinical course of back pain, including acute, subacute and chronic. So what is disgusting about this is that the authors and of course the Institute of Muscular Health is chiming in. They are wanting taxpayers, that's you and me, to pay for their useless, poorly validated, misinterpreted, biased, conflicted management strategies that ignore biomechanical movement proficiency. Okay, so they're looking at the data. We already know 70% of people recover after 6 weeks of acute pain, and then if they don't recover, they go on to subacute pain, and then after another 6 weeks, they say that another 70% improve. So that really means that, you know, you're getting about 1 in 3 people who develop pain, relapsing and remitting pain, but don't recover and go on to a life of pain and disability with chronic pain, which is a completely different beast. And then they talk about these factors like body weight, depression, stressful life events, low self-efficacy, higher levels of fear and anxiety that are risk factors. Now, this is just absolute nonsense. These things may be associated with your makeup when you're in chronic pain, but they are not the cause of your chronic pain. Of course, when you have chronic pain and your life is going down the gurgler in every facet because you can't bloody put your socks on, of course these things are highly relevant. They're not the cause of why you had the chronic pain in the first place. And then we go to the treating pain. Okay, this is the clincher. We've got to get rid of the idea of things being wrecked, because with most back pain, nothing is wrecked. Nothing may be wrecked, but your treatment has been so poor that you've progressed to chronicity. That's what we're trying to say. We're not trying to say that you're wrecked and that you can't recover, but if you deliver very bad treatment in the first place, you are going to feel like your back's wrecked, and that's not acknowledged at all in the article and the publication. And then they want us to go on to pay for their sensory motor retraining. They want us to go and deliver these types of rubbish cognitive functional therapy that has no focus on biomechanical movement proficiency. They don't even talk about what defines good movement. They don't know how to deliver good biomechanical retraining, and yet they're whinging and whining about the government and taxpayers not paying the poor physiotherapists from South Australia and Western Australia and from the Institute of Musculoskeletal Health in Sydney. They're going on about us paying for their 12-week cognitive functional therapy classes, and they're getting all upset about only getting subsidised 5 weeks or 5 sessions. Dr. Ma says that that's not enough to cover the new programs which require between 8 and 12 sessions. Okay, and they've got to hide to say that research has shown placebos are no more effective than opioids. what else do they say? Medicare pays for spinal fusion and spinal cord stimulators, but they won't pay for our cognitive functional therapy. Well, maybe that's because you're so bloody hopeless that people's backs eventually do get destroyed and severe spinal stenosis and severe instability that they do need a spinal fusion, which does actually restore stability. That's why the government pays for those operations. But your cognitive functional therapy, which has absolutely no focus on biomechanical movement proficiency and eliminating central sensitization, and takes 12 sessions, and you're also going to get paid to retrain 1,000 physiotherapists to become cognitive functional therapists. Yeah, I'm sure you want taxpayers to pay for your stuff, but I can tell you something, it's not going to fix back pain because it is not addressing the cause of the back pain in the first place. So if you do not address the cause, then you're just throwing more money, more of taxpayers' money at the problem. Okay, so this poor lady here who's got terrible debilitating back pain, getting some cognitive functional therapy, having a good old chat, guess what? If she doesn't relearn her movement and biomechanical proficiency to get up off that couch and move properly when she sits down on the couch and move properly when she bends over to pick up her glasses off the coffee table, all the cognitive functional therapy in the world is going to be an absolute waste of time. All right, signing out.